Hi, it's David Vlahov, the Dean of the UCSF School of Nursing, and I'm reaching out to the faculty and staff of the school. The reason why I'm reaching out to you is because I promised you I would. We had the State of the School in May, the rally in September, and we've had some face-to-face meetings as well as small group meetings. I said that periodically what I would do is reach out to you through YouTube like a fireside chat, just to give you some comments and updates about what's going on. So the first thing to tell you is that I'm really proud of the work that the rally groups have been doing together. I think the interface group has really made a lot of distance in their projects. They've had 17 individual projects, people coming together, learning about each other, and bringing in resources from the campus. So they're developing a concept sheet and an inventory of what they're doing that I think is going to be a really good narrative to be able to communicate to others. The transition group developed a very strong conceptual framework showing the full range of transition issues. After that meeting, there were a number of subgroups that have developed, and some of them are going on to look at data that are available and to develop proposals going forward. And I'm very excited about those initiatives, and I think they're going to turn into NIH proposals in the spring. The prevention policy group got together, and they've had some good conversations. One of the most important elements for them has been getting a survey from the faculty about what projects are going on in Oakland and in San Francisco. Who are the contacts? Are they active? And the idea is to generate a map of projects to see what kind of resources the school has. The Atlantic Philanthropy Project in the Oakland schools is one example, and so how many more can we build on that? And that's a resource in which to leverage into new projects and ideas that we have. So please, when you get the survey, complete the survey and return it. We really need it in order to move that group forward. The symptom management, the fourth group, has had meetings, and they're putting together a concept sheet. I'm excited about some of the new directions that they're taking. So those are the four groups. I think they're making great progress, and I'm looking forward to meeting with them again soon, seeing how that's coming together, and also to talk with each other about the crossover between the groups. I think the transition interface group crossover is just exactly what we're looking for. So people are moving across the different groups, and I think the creativity is really sensational. Now, as these groups have been meeting together, you'll notice Teresa Schertzer has been part of some of these discussions in groups. And the purpose of that is she is doing a process evaluation. And I've asked her to do this not to be snooping on individuals, but really to be able to get a sense of what is the process, what are the things that, you say one thing and people hear another, what's the kind of feedback that we can use to help correct the process as we're going along. And so it's anonymous in terms of what she brings back to discussion, and I think that's helpful. It's, again, one of the reasons for having the fireside chats was some feedback that she was able to bring. So as we're talking about the rally and moving forward, I think we're also looking at what are some of the different options, what are the different challenges that we have. The rally is looking forward, right? It's looking forward, what are the things that we can and should be doing moving forward, right? So there's vision that's there, and we really want to look into the future. But we've got challenges today, and we're all anxious about those challenges and exactly how we're going to deal with them, right? So it's hard to look at the future if you're anxious about today. There are a number of options that we're looking at the same time as we're looking in the future. One of them I just want to mention in passing is the ambulatory care center. You know, I went over there one evening and I noticed it was empty. And I went back 4 nights in a row after that, and it still wasn't being used. So I wondered, and I then talked with some of the clinical faculty to say, you know, if the space is open, would we be interested in having a clinic there? It would be faculty practice, it could be for teaching, it would be a service to the community, right? People wouldn't have to take a day off from work, those that live in the Parnassus area. You know, there are a number of different ideas that we could put together and something that could be self-sustaining. So people said, well, let's explore this. Is this something that's even possible without thinking of all the detailed considerations? So the faculty that I talked with, not all the faculty, but starting to probe, thought, you know, this is something that we ought to look into. So I've had conversations with UCSF Hospital Administration, Ken Jones, for example, and then I talked with medicine and Josh Adler from the Medical Center, Talmadge King, Ralph Gonzalez. And I can keep going through a number of names. And the response coming back has been, well, let's develop the idea. And that's exactly what we're doing. We're really trying to look at what are some different options for having something that the School of Nursing can be a leader. It can serve the needs of the university. And certainly the Chancellor's goal number 1, you'll remember in the presentation at the rally, was to have a better patient experience, increase access, better care, patient-centered. And so having a clinic like this that's tied in with the rest of the enterprise could in fact fulfill some of those goals. And that's how I think the campus is looking at it, is there a win-win for everybody? And there's, I've got some hope on this one. I think it could be a direction moving forward. And that's something that we should not say is done. It's certainly something that we're developing. So what does this mean? Well, there's a flip side to this as well. And that is there has to be expectations for all of the faculty. And my understanding is that it's not entirely clear to everybody. But what I'm looking to say here is that we need to have a minimum expectation. And in this case, it's that 20%, at least 20% of your effort come from external sources. And that can be in the way of grants, in terms of clinical outcome, in terms of consultation. You know, it's some external source that's coming in. Well, that fits in nicely with the idea of the clinical situations that we're working to develop. They might provide a platform that fulfills the needs of looking at supporting faculty, providing the teaching, a platform for research, the service that we say is important to us and that we want to do. So I look forward to talking to you all individually. I just want to make sure that you all were able to get a message, and if we don't see each other, happy Thanksgiving.